organizers, and we know when you organize, one-on-one is the best way to go. So what we're doing this afternoon is coming together to craft a pathway to victory for single-payer health care, Medicare for all in this country. So as organizers, we know that victory will require a powerful grassroots movement that incorporates the concerns of other social movements into its narrative. And as organizers, we know the only way to come together such a big movement is by holding one-on-one conversations with people and connecting with their felt concerns. Today, we will hear from a panel of activists with a broad range of experiences with that kind of, we call it the deep organizing. I like that term. So on our panel today, we have as our first speaker, let me just share with you. I got everybody's name. I spoke to them individually and said, how do you pronounce your name? Well, I share with you, that probably didn't work very well for me. So our first panelist is Beth Gagne, who is from the Maine State Nurses Association and NNU, who will talk about their just launched listening campaign that trains union members to hold one-on-one conversations with their co-workers and to speak at public events. Mary Beth.
Hello. Back in the springtime, the AFL-CIO, along with Michael Leidy and Chris Nielsen from NNU, we met and started training union leaders so that we could go back to our unions and get deeper and broader into them to talk about Medicare for all so that we could have more workshops and really train other people. The second part of what we're doing is healthcare listening. So some people do not want to go out and speak to groups. They might want to do things one-on-one. They might want to talk to their family members, their coworkers, people at their church, friends, and that sort of thing. And what that means is that they are listening to what people are dealing with their health care or lack of health care. And another group that we're listening and talking to are laid off union people and what's happened with their health benefits since being laid off. And then along with listening, then we are bringing up Medicare for all and talking about how that could help everyone. The other thing that we're doing is we support candidates who will have a platform for Medicare for all. We most recently endorsed Jared Golden. He's running as a Democrat against Bruce Poliquin, who is a Republican representative from our state. And we supported a successful campaign for him. And so we're pretty busy, even though we just got started. We're doing lots of meetings and working on this.
One would think for the work that they're doing, it would take a longer presentation because they are really doing stellar work. It's like, and here's what we're doing, short and sweet. Sometimes short and sweet is good, and this is one of those days. Thank you so much, Mary Beth. Our next speaker is Dustin Guastella. Don't you just love it? Dustin is from the Democratic Socialists of America, and he's going to talk about their multi-city canvassing campaigns where they door knock on working-class neighborhoods and canvassers seek to hold open-ended conversations about health care to the people that open the door.
Thank you, Marva. And thanks to Healthcare Now and the Labor Campaign. I'm really excited to be here on behalf of DSA. I wanted to talk about three things today, what I think are the three key approaches to the Democratic Socialist approach to winning Medicare for all. And those are, one, clarity in our demands, 2, naming the enemy, and 3, a mass approach to political organization. So first I want to talk about clarity. What do I mean by that? I mean political and ideological clarity. The Democrats right now are floating a lot of phony single-payer bills. We've heard about them quite a bit. They're calling them Medicare for anybody, or Medicare Part X, Y, or Z, or Medicare Part anything that goes. Now, the only reason they're doing this is to distract from our demand, which is a federally funded Medicare for all single-payer system. But in order for us to get that across, in order for us to get across what is Medicare for all, what's a real, robust Medicare for all system, we in DSA developed what we think are the 5 basic principles that make up a Medicare for all, a real Medicare for all system. So 1, what we say is that it's a single system. It's not a patchwork, right? 2, we say that it provides comprehensive care, right? We want all services provided by a medical professional covered. 3, we want it free at the point of service. That means no fees, no copays, no premiums, ever. 4, we want universal coverage, and that means all U.S. residents, because the flu doesn't check your green card, and neither should we. And 5, we want a just transition for all those workers that will be displaced when we abolish the private health insurance industry. That's jobs and severance for all those workers. So this leads us to the second thing. How are we going to get all this, right? Well, we have to name the enemy. We have to talk openly about why the United States doesn't have a social health insurance system. And the reason the United States doesn't have a social health insurance system is not because we haven't tried. For over 100 years, workers in this country have been pushing for something like socialized medicine. In 1943, we almost won it. We had the Wagner-Murray-Dingle bill. And this would have socialized a huge chunk of what we call the healthcare system today, and it would have nationalized hospitals, right? But we lost. And why did we lose? The reason why we lost is after World War II, the ruling class in this country emerged triumphant, and they went on an all-out offensive against anything that looked or smelled like socialized medicine. And the reason they took socialized medicine wasn't just because they have some sort of crazy, evil understanding of the world. It's because they know that socialized medicine is about class power. And that if we had a social insurance system, workers would be able to strike. They'd be able to organize. They'd be free to bargain for better working conditions and more freedom on the job. So the ruling class in this country said, no way, we're going to make sure that we have an employer-dictated system that chains you to your job, that makes sure that you can't be free to do those things. And so what we say is we have to point the finger squarely at them. Healthcare is a moral issue, and we know healthcare is a human right, but healthcare is a class struggle. Healthcare is about us versus them. It's about teachers, nurses, electricians, firefighters versus billionaire corporations, versus health insurance executives, versus social parasites that are leeching off the working class to make billions of dollars. So finally, how are we going to beat this entrenched ruling class? And this brings us to a third point. We have a mass approach to political organizing. And we do this through what we call mass canvases. We know we're going to need a truly mass movement to win Medicare for all. And the only way to build that mass movement is to revive a somewhat dormant political tradition in this country. And as Marva said, it's deep organizing. It's programmatic political organizing. For a long time in this country, for the past 40 years or so, a lot of left-wing advocacy has been based on stunt activism, celebrity endorsements, high-profile press conferences. But this is not how we're going to win Medicare for all. The way we're going to win Medicare for all is shop to shop, door to door, person to person, face to face organizing. And so believe it or not, this actually isn't hard to do. And we've been doing it in DSA. DSA commissioned 8 volunteer regional organizers to mobilize some 60 of our chapters across the country, to move some 1,000 of our volunteer members, to knock on doors for 12,000 different people in different cities, states, across the country, to an audience of over 42,000, and that was in one weekend in April. And we need to multiply that tenfold if we're going to win Medicare for All. So I'll just close with this. I believe in this demand. I believe in Medicare for All, and I believe in social health insurance. And I think it is the key working class demand in this country. And I think it's not just about winning health insurance. What it is about is the defeat of the most entrenched ruling class in the history of the world. What it is about sparking a new 21st century working class movement in this country for universal goods and for demands that help the whole working class. And finally, what Medicare for All means is it means the establishment of a real and durable democratic socialism in the United States. Thank you very much.
I'm just going to make sure that he has my address. If he's knocking on doors, I want to be one. Oh, he didn't look like he was willing. I was getting a little concerned right then. So our next panel, I know where he lives, so that was a joke that he could knock on my door. I'm going to go and knock on his door. So our next panelist is Mary Lopez. Correct? I got that right? Mary. All together now? No. From the California Nurses Association. She's going to talk about the multiple experiences they have had in the campaign for a healthy California.
Thank you. Hi, everyone. Such an honor to be in this space, really. I've been doing healthcare work for quite a long time now, and every time I come into a room full of folks that feel the same way I do, I feel very privileged to be in this space, so thank you. I really want to share a little bit about what's happening in California. As you all know, we launched in 2017 our single-payer campaign, our bill, SB 562. It's led by the nurses, of course sponsored by the nurses. Before I share some of the things that we've been doing, I want all the folks from California to please stand up. Please stand up. Nope, stand, please remain standing, because everything I'm going to share with you is because of these folks. Okay, some folks are too tired, they're going to sit down, that's fine. So when we launched it and the bill was introduced, again, SB 562, to bring single payer to California, we set out and trained nurses and volunteers to go out and spread the word and talk to everybody. And they hit the road running. We across California, from San Diego to Eureka, we put on Train the Trainer events to teach folks how to talk to single payer from every angle, from business folks to people of color. And so from there, they found out across the state. They use those skills and that energy to present in any space that would listen to them, and particularly heating up Dem clubs. Dem clubs were really important because they led to a win in the state. Actually, the state Dem party actually endorsing SB 562 as their platform. And we got really creative. There are folks here, y'all remember the play Hamilton? There were folks who actually canvassed Hamilton, and there's a couple of folks in here who I know are regulars out there. Kristen, if you would stand up really quickly and be recognized. And Maureen over there, these folks stood out in front of Hamilton and passed out information about SB 562, and really, again, we're very creative and diverse in letting folks know to do about the campaign and about what we were trying to achieve here. Because as we've been talking about all these last couple of days, it is about letting folks know and educating everyone and everybody and everyone who will listen to us. So from there we started building our canvases. We are doing the door-to-door. We, on a weekly basis, because this is gaining momentum and energy, We hold 9 to 12 canvases every single weekend. And we have an average of 20 to 30 volunteers going out and knocking on doors, letting folks know about this. We've already had over 1,000 volunteers participating with the campaign, and we've reached countless folks as well. And again, the support is growing in California. Now we're moving on to our phone banks. We're doing phone banks in California as well. We've just started those last month. We've already completed 18 phone banks. And one of the things I want to mention, because I did start to say that we do have a single payer bill, so SB 562. It made it through the Senate. It's currently being held in the Assembly by the Speaker of the House, which is basically the President of the Assembly. And folks have been very particular about canvassing his district every single weekend to put him on notice. And so much so that he hides from us every time he knows we're going to be in a space. Our efforts, our canvassing and our phone banks, folks, have included our messaging in different languages too. This is really important because if you've spoken to me at any point on this day, you've noticed that all I keep talking about is including people of color and doing things in multiple languages. And so that's really, really key. We're forging relationships with immigrant rights organizations, with poverty organizations who work in communities of color, with the Black community, women's rights organizations. And we're just launching a new initiative called the Faith-Based Alliance for Us, and that's where we are hoping to launch it with a single day of service in which we get as many churches, church leaders in California to basically dedicate one of their services, or a day, or I should say a Sunday, to talking about and focusing on healthcare. And so that we'll be outside also with volunteers outside those churches to sign folks up and to have them share their healthcare story with us. So as you know, we just won the primary. One of our strongest supporters of single payer just won. And so we're very hopeful about winning single payer in California. And as you all have heard often enough, what happens in California, there goes the rest of the nation. So we're hoping that we can lead the way. We have a friendly rivalry with New York to be the first one. And so, again, really want to just recognize the wonderful people in this room from California. But again, all of the work that you've done. I'm here because of all of you. You've all have not given up. And so because of your tenacity, then I have the privilege of standing here to share with you how we carry on. Thank you.
It's really great to hear, New York and California in a battle, and neither one of us can rap. So I'm thinking this battle, East Coast, West Coast, was a joke I always tell. East Coast, West Coast, and none of us can rap. So, I can't. I just take that on myself. So our next panelist is Susan Aarup, who is a disability advocate from ADAPT Chicago. And she's going to be discussing the unique concerns of the disabled community and the importance of the single-payer movement to incorporate those concerns into our proposals. Susan.
Thank you. I'm glad to be here, and I am going to put you on notice. There's only 7 of us here, 8 of us here from Illinois. Could those people from Illinois please stand up? Half of those people who stood up have disabilities. We are a force to be reckoned with. And they told me they wanted me to speak man. That was the wrong thing to do. But it wasn't the wrong thing to do. For many, many decades, people with disabilities have been shunned. We are considered often to be the unheard, and to say. And without single payer, our medical establishment will keep getting worse. But there are parts of it, the long-term care debate, and it's a debate because there's a big debate as to what's medical and what's a social service, and what kind of service can be performed by a doctor versus a personal assistant. When many of those services that I need to stay in my home, and that many folks with people with disabilities need to stay at home, can be provided with personal assistance. If a doctor tells me how to explain it, then the personal assistant can help me do that. And then if there's another thing where I feel more comfortable going into the clinic, I can do that. That's consumer control. In Illinois, with our home services, they have tried to take away our consumer control and tie this medical insurance that's supposed to be so good to our employment. Well, that's fine, but I'm here to tell you that 75% of people with disabilities don't have jobs because they're too scared to employ us, and they think the accommodations are going to cost too much money. Well, that's a bunch of bull. But healthcare is the only way to go, and long-term care services should not be in insurance. I have friends who have policies on long-term care because they could afford that, but they don't know if they're going to still have it in 10 years when they need it. We are all that much closer to having a disability. If you live long enough, I can guarantee you you're going to have one. And you're going to need long-term care services to be in this bill. And I am sick and tired of being told what services I'm going to get and decisions made without me. And it's everybody in, nobody out. And it's also nothing about us without us.
Thank you so much, Susan. All of us are well aware whenever you go to any state capital, if you go to Washington, D.C., those sisters and brothers who are like you are the ones that are really putting it on the line. They're the ones getting arrested. They're the ones that are saying what you want doesn't work for us. And I thank you for your bravery and for your words. I thank you. So what I'm going to try to do is take a few questions, and I mean a few. Uh, but before I start that, I have a colleague here from the Business Alliance for a Healthy California. His name is Dan Geiger. I know he's behind me, right? I got eyes in the back of my head. I knew he was behind me. He would like to be the person to give you some information. And please be aware that all of us in front of you are part of this conference. So any one of us you want to talk to is fine. So, but I'm going to give it to Dan.
Thank you very much. So I'm really pleased to be here. I want to tell you a little bit about what we're up to. We're based in California, and we're working to educate and organize businesses to support single payer in California specifically. And we believe actually there's a pretty strong business case to be made for a lot of companies who are not in the insurance industry. We have about 400 supporters, and they range from Patagonia to Modern Times Brewery to the corner mom and pop shop neighborhood business. And we think really, we have a great potential to cultivate allies. And this is actually an opportunity to, if you might say, divide the corporate sector. The financial industry and the insurance industry and all those are one side, but all the rest of the economy is subsidizing them. They're paying, in the neighborhood of 15% of payroll for health care, and they're getting screwed. So there's actually a business case to be made to them, and they can be very powerful. So, for example, we've sort of worked and helped support a group called Small Business California, and they surveyed their members, and 57% of them support single payer, and they as an organization endorse single payer. And small businesses are very powerful constituency politically, right? They employ half the people in California. So that's actually kind of a big deal, I think. So kind of what we do, we work very closely with the nurses. We're part of the campaign. We're there for everything. And we have a lot of volunteers for Healthcare for All who we work with in LA. Some folks just organized a forum at UCLA Anderson Business School that I and others spoke at. And San Diego, same thing. A lot of parts of California, people are organizing events. And the Bernie Kratz in San Francisco have been going door to door to local businesses, getting them to sign up, another small business for California. And so if you check out our website, the name of the organization is Business Alliance for Healthy California. The website is BA4HCal.org. We have a lot of resources and tools that people could use if you're interested in starting similar efforts in your area, presentations, webinars, and all that sort of stuff. So please use them, how to make the case to a business person. And we're happy to, talk with anybody who wants to do similar kind of work around the country. So I'm really pleased to be here, and we're with you 100%.
Thank you. It's always really great to have supporters. It's always really great to have those supporters willing to stand in front of you and tell you what they have to offer. So every one of us knows that you don't get anything done. I have a huge voice. This is my indoor voice, believe it or not. It really is. I have an outdoor one that I try to use outdoors. So just to have somebody come up and say, I'm with you, and whatever you need, I'll see what I can do to help you really matters. So I'm now going to take a couple of questions. If you have any, I'll even walk myself over to the person. La-dee-da.
If you ask me to, sure. Okay, or tell me to. I'm Eileen Weber. I'm a proud member of the Minnesota Nurses Association and teach nursing at the University of Minnesota. And we've had a lot of discussion of coalition building and messaging and organizing, but the end game is Election Day. And I was just wondering if any of the groups could share any of their voter registration and voter turnout strategies, because you know what they say about midterms, that the turnout's always low. And I think we should break a record this year everywhere and have the turnout match what it is in a presidential election year.
I don't know if anybody on the panel wants to address that, but certainly those of us that live in the state of New York, are very into making sure that GOTV, as all of you know, which is Get Out the Vote, is a real thing. We know that during the midterms that most people really don't care, which means that they're not paying attention. Because in other states, if you don't vote, you don't get the vote and when there is an election for president. So all of you that don't live in New York should pay attention to that, because you may be in one of those states that they are looking at all the voter rolls, and when you go to vote, oh, see, who knew? I know. So when you think that going to the polls means that you're going to vote, depending on where you come from, you might be wrong. Does anybody else here want to address that? Sure you can.
So in California, we had a candidate that we really believed in, and we needed him to win the primary in order for us to get what we needed, which was single payer. So what I found interesting is because California Nurses Association and the campaign, we have our 501c4 and our 501c3. So, but what I found really interesting in the conversations in the campaign is that folks really saw the importance of connecting these two. That they realized that we were not going to win single payer unless we got the candidate in office who was going to support this. So I think it went a lot without saying for many of us. And so we had these conversations offline with a lot of them, and it really didn't take a lot of our urging. It came from the volunteers and the folks that we connected with, who came and shared this information with folks in these spaces to say, we got to push folks out there to get out there and vote. So people are making the connections. CNA we were doing our own thing as well with in pushing the vote out. And we had actually our Gavin bus that made its rounds. So we were raising the awareness of the candidate that we believe would support single payer. But a lot of that work came from the volunteers. And again, we just encourage those spaces to have that conversation and to let them connect with one another about pushing out the vote.
Thank you. One more. I'm just going to walk right over to you because you put your hand up.
Did you ever try stand-up?
Let me just share with you. I am retired. Not that anybody would think that I am, because I work harder than ever, but I actually want to be a stand-up comedian. And that's like, it's like, what do you want to be in your next life? That's what I want to be. So when I act like this and I say to people, I actually act like this, that they're like, why don't you do stand-up? So my answer to that is, will you pay to see me?
I would. My name's Ed Klein. I'm from Hope in the Midwest. I would like to, not sure, the gentleman here just really, piggyback on that, because the business community is our ally. That, just what you said there, these health costs that are out of control hurt the business community tremendously. The other thing is they want healthy employees. And the way the system is, obviously people do not go to the doctor, and they weigh all these other reasons why not to financially. Case in point, my brother, who is way more conservative than me, is a CFO of a company with about 50 employees, and he has told me how hard it is, and every year it gets harder. One of his jobs is to find the health insurance, and it is just out of control. And so we really need to contact these CFOs, CEOs, and let them know exactly what this is. Information, I think, is our biggest weapon. We really need to get out and let these people know how we can help them. Thank you.
And check out Fix It if you haven't. The film Fix It. Enjoying a big money agenda tonight.
I have been told that was the last question. Sorry. I want to thank everybody sitting up here in front of you. I thank them for the excellent work that they do. I thank them for not just being advocates for their organization and themselves, but for every American. Because guess what? Everybody needs health care. It should be everybody in,
Nobody out.
thank you.
We're going to do one thing before you guys come up. Got 5 minutes before you come up. Okay, thank you very much, panel. That was really inspirational. And to amplify on what Marva said, Susan and brothers and sisters, I was wandering around Capitol Hill a lot last summer when the debates over replace and repeal were taking place, and I am convinced that it was the actions of disabled Americans that prevented the privatization of Medicaid. And I believe that we owe a debt of solidarity to that community, and that we need to find a way to incorporate their concerns into any piece of legislation that we support and promote. And the Labor Campaign for Single Payer is committed to do so. But that's not why I came up here to talk to you. Lock the doors, please. We need to talk about how we're going to pay for this fight going forward. We run on the power, the grassroots power of people, but every army has to eat, and every conference has to pay its bills. We could not have done this conference this weekend without the amazingly generous support of National Nurses United, which made it possible to do this conference in this one wonderful place with all of these Scandinavian themes, so we could dream about a world where healthcare is a right while we're meeting here amidst the fjords and the Norways and the Swedens. So NNU has come up big time in order to do this. And then, of course, the 14 local unions that Rose Roach read out last night, who helped raise the money to hold last night's reception, and then the amazing staff and financial support of the Minnesota Nurses Association made this weekend possible, and we want to thank them. But we also need to challenge the rest of you all to step up and think about how we're going to pay for this movement and fight this fight. So I'm calling up my good friend and newly organized union sister, Lisa Patrick Mudd, to share some of her ideas about how we ought to be paying for this fight moving forward. Lisa.
Thanks, Mark. Hey, everybody. Is everybody having a great time? I am. And I know you've all traveled really far, and you're paying your way here. You're paying for your hotels. You're paying for your plane tickets. You're paying for your food. And, as Mari said earlier, it's a privilege for us to be here. It's a privilege for us to have not only access to health care, but to come to events like this where we can be with people who share the same ideas that we do about what it means to be a human. So I want to ask folks here to really think about what it means to you to have an organization like Healthcare Now and the Labor Campaign for Single Payer supporting the work that's going on all around the country. We have new chapters of Healthcare Now that are being organized in Kansas and Virginia. And those folks are, we're here for you. We're here to support you. And Ben and Stephanie, just everybody knows who they are. Yeah. These are amazing people that do so much with what little that we have as in terms of a budget of Healthcare Now. And we are so fortunate to have them and their talent and their compassion and their just willingness to work 80 hours a week, and to do the things that they do with so little. And that includes things like helping our smaller chapters with web pages, with databases, with abilities to collect funds, and that's not something that we can continue to do. We need a backbone. We need people that are willing to help us organize ourselves, because as much as we want to believe we're capable of that, and as much as we want to believe that we're capable on running this movement on the power of volunteers, we're not. We need to have paid staff. We need to have organizations so we can put on events like new Train the Trainer, train new leadership, how to organize in your workplace, in your union. All of these things take resources. And I know that everybody in here gives generously to a lot of causes. I try to give what I can. My mom, who's on a retiree income, gives $5 a month to Healthcare Now. And I know that you can do that. I know that you can because you made it all the way here. And if you can't, I bet you know somebody who can. And if you can do $10, if you can do $20, if you can do $50, I really urge you to consider doing that. I try to raise about $2,000 a year for Healthcare Now. And I ask friends and family, and they expect that call in December from me saying, hey. So I just, it's easy to ask for money for something that you believe in. And I know that we all believe in healthcare as a human right, and that's why we're here. And I want us to, as another sister said earlier, let's put our money where our mouth is. That $10 you use to go to the movies or to, eat out for lunch, or that latte, there's sacrifice involved. And I know that we've all sacrificed, and I know especially the staff of these organizations have sacrificed. And I just want to encourage everybody to give generously, and if you don't, I'll stick Mark on you.
Okay, is the union sister or brother in the room who could in 2-3 words explain what a free rider is? Who could tell us what a free rider is? Pardon? They want something for nothing. Well, there should be no free riders in this room. Everybody has to pay their dues. Is there anybody who can kind of tell us what they can do to help support the Medicare for All campaign? Yes, brother.
On behalf of the Washington State Labor Council, AFL-CIO, I'd like to donate $2,500.
All right. Eric Gonzalez, thank you. Brother. Yes, Rich.
Yes, the ILWU, which represents more than just longshore on the West Coast, but plantation workers in Hawaii, hotel workers in Hawaii, and nurses in Alaska, and boron workers and boron in warehouses up and down the coast, had to check the $4,000.
All right. And Rich, just to challenge some of our other unions that are much larger than the ILW and that are in the room, what does that represent per capita per member?
So that's a dime per capita, because we got about 40,000 members in the union.
All right, thank you. So is there anybody in the room who could maybe think about making generous individual contributions to the labor campaign for single payer? Yes, the sister over there. Thank you. And if you see on your contribution forms, you can designate either Labor Campaign or Healthcare Now as the recipient of the contribution. How do we sign up if you want to give a monthly contribution to Healthcare Now? Do you just go on the website, Ben? You can do it right now on your phone, on the card, and it'll start. The money will start coming out probably by Tuesday. Is there anybody else who wants to say something? All right.
I just want to ask, how many folks in the room are already monthly sustainers of Healthcare Now? Thank you, thank you, thank you. We depend on you to be able to set our budgets and set our priorities for the year. Is there anybody in the room that's willing to up their monthly contribution? Anybody? Matt Petty from PNHP. Excellent. Any other folks who are willing to? Katie Robbins. All right. Thank you, guys. Monthly contribution? That's beautiful. Thank you. Brother in the back.
All right. Thank you so much. Bill?
Rather than give a little bit every month, as you know, when I come to these conventions, I like to do it all at once. Here's $1,000.
All right, brother.
All right, folks. Yeah, we know we're not in the room with the 1% here, so we understand. A lot of us are healthcare workers and, in the public sector, and we're not rolling in the dough, even though we are doing the Lord's work. I think that, folks, if you can think about this, you don't have to give us the envelopes right now. If you want to think about it, if you want to sleep on it, we will take your envelope tomorrow. You can, when you get back home and you're like, damn, I wish I would have signed up. And, you're, as me, my Catholic guilt sets in. And, I'm like, I wish I would have done that. You still have the opportunity. You can sign up online to donate monthly to Healthcare Now or Labor Campaign for Single Payer.
Okay, well, I got a little Catholic guilt going on too, but I also know the priests didn't let us leave the church until the collection plate was turned in. So I'm hoping that you can turn in a pledge card to one of the volunteer collectors as we move on to the next part of our program. We really need to take a long-term look about how we're going to fund this campaign and move it forward. And thank you all for your generous contributions, and we need to go home and double and triple that. And thank you, Lisa, for your passionate advocacy for funding our programs. Okay, so I'd like to call up Alex Lawson, who is going to introduce our next speaker. I think that mic should go.
Well, thank you so much. My name's Alex Lawson. I'm the Executive Director of Social Security Works. Oh, thanks. It's really a joy to be in this room with all of you here. You are the muscle of this movement. Because of our work together, we are at a place that is actually hard for me to believe in the fight for guaranteeing health care for everyone in this country. And for that, I would like you all to give yourselves a large round of applause, please, because we are going to win. Because I talk to people, and I haven't heard even a small diminishment in the fight. In fact, people are ready to go. People want to do more, and now is the time to do it. I want to say that the danger of moments like this is not that we are going to get nothing, because we have built a movement that is shaking the foundations of the establishment, and they are scared of what we've built. So what they're going to do is they're going to try to substitute garbage for guaranteed health care. That is the co-opt stage. That is the peril that we're facing right now. And that's why we need a shared analysis, and this strategy conference couldn't come at a better time for doing that. So it's my great pleasure to introduce someone who can really delve into why commercial insurance can never be even a part of the solution when we're talking about guaranteeing health care for everyone in this country. Diane Archer is a tireless truth teller and fighter for guaranteed health care. She founded the Medicare Rights Center in 1989. She is going to go through the dangers of allowing commercial insurance. We know what that looks like with Medicare Advantage, right? It's like a festering, growing thing within the system. And I'll keep it really brief, but one of my favorite things Diane ever said, because we spend our time a lot fighting Medicare Advantage. Just anything that allows the private insurance into traditional Medicare. And one time she was a little bit angry about somebody who was pushing Medicare Advantage, and she said to me, I taught him everything he knows about Medicare, and then he's turning around and pushing Medicare Advantage. And that fire and passion that she brings to this fight is what we need. Diane Archer.
Okay. Yeah. Okay, good afternoon. I am thrilled and honored to be here with you to talk about Medicare for All and what we need to be aware of as we push forward. One thing we all know is it's time to fight hard for Medicare for All. It's time the public got behind a broad, bold vision for health reform that moves us to a single federal health system, treats everyone equally, and reins in costs and recognizes the perils of keeping commercial insurance in the mix. So what are the biggest perils? The good news is, as you know, that a solid majority of Americans support expanding Medicare to guarantee coverage for everyone. And that includes nearly half of all Republicans. That's because it offers true freedom, choice of doctors and hospitals anywhere in the United States, with doctors and hospitals competing for patients and without insurers getting in the way. The bad news is that most people, policymakers, and the general public do not understand that to expand Medicare properly, we cannot split the baby and keep commercial insurance in the mix. We need to cut the overhead and bureaucracy that commercial insurers bring with them. We need to eliminate employer coverage and the job lock it creates as well. We need to bring down costs and drive long-term improvements through a single federal system. Most people, and that includes members of Congress, do not begin to understand key differences between social insurance and commercial insurance. If they did, they would appreciate the dangers of building on our broken healthcare system. They like the fact that Medicare regulates doctor and hospital prices. That is critical, necessary in any viable healthcare system, but it's not sufficient. The problem is not simply costs. Even if Congress decided to extend Medicare's lower prices to everyone and cut our healthcare costs significantly, the U.S. health system would still not be meeting our individual or collective health needs. And this is a point that's lost on a lot of smart people. We need freedom, meaning choice of doctors and hospitals anywhere in the country. We need a system that doesn't ration care. We need to promote innovation that drives system improvements. We need to end systemic bureaucratic waste and profiteering. We need an efficient system. I hope I'm sounding like a Republican, because we need to move Republicans. And these are all values that should appeal to Republicans as much as Democrats. What makes Medicare work is that it is designed for everyone, truly one size fits all, for the public good, not for profit. Automatic, guaranteed. It brings everyone together so that the cost of our care is spread across everyone. Medicare for All addresses the failings of our healthcare system today. It addresses the unaffordable healthcare costs that are killing us, figuratively as well as literally. Even with Medicare today, which needs to be improved, as long as you have supplemental coverage, big as long as, your costs are the same whether you need a lot of care or a little. You can budget for your care. You have the freedom to get the care you want wherever you need it, anywhere in America. If you're here in Minnesota at a conference, you can get care. If you're out in California visiting a parent, you can get care. If you're in Delaware with a friend, if you want to go to Texas to MD Anderson, you can get care. Wherever you are in this country, you can get care. That's what we need. Medicare for All gets to the root problem with our healthcare system, which is far more problematic than the costs. It treats everyone equally, young and old, Easterners and Westerners, rich and poor, healthy and sick, no matter where in the U.S. you live. It guarantees us all access to needed care without the burden of high costs if we are sick. It's accountable to the public, not to shareholders. Commercial health insurance limits our freedom to see the doctors and use the hospitals we want and need. It discriminates against people who need costly care. Through narrow networks, high deductibles, and copays, it rations care and does not look out for the long-term collective health of Americans. The commercial insurers claim much of their data is proprietary, so there's a lot we don't know about them. But we all know people with insurance are dying for lack of health care. We all know people who aren't taking their medications because they cost too much, who are not going to the doctor or the emergency room because the deductible is too high, who are making choices that no one should have to make. Our challenge is that we're going to need to make Congress pass Medicare for All. We're going to need to exert enormous political pressure. We're going to need to help the many people who think they're satisfied with their commercial health insurance and who are scared of change think again. It's pretty easy to fear change if you're relatively healthy and use very little health care. It's also pretty easy to embrace change if you understand that you or someone you love is likely, eventually, to need a lot of care that may not be available to you or your loved one in a commercial health insurance system. I love this image of the broken chain. It says it all. Commercial health plans are only as strong as their weakest link, and that link is weak. We need people to understand that these plans almost have to be in a race to the bottom, steering clear of delivering good, affordable care to people who most need it. Think about it. When was the last time you heard Aetna or United Health boast about its great cancer or stroke care? Say, join us if you have heart disease. We want you. In New York, not a single plan on the state exchange includes Memorial Sloan Kettering Cancer Center. Why not? The plans want to keep people with cancer from signing up with them. Where's the health plan that says if you need costly care, you won't have any out-of-pocket costs? That's the one we all want. But you can't get that from a commercial health plan. The more care you need, the more you pay. It's as if they want to make sure you feel the pain financially as well as physically and mentally. Commercial health insurance doesn't work like other commercial products and services. Anyone who thinks otherwise is kidding themselves. Think about it. If the restaurant marketplace worked like the commercial health insurance marketplace, restaurants would be seeking customers who only wanted their free bread and water. Commercial health plans want you to sign up, and then they don't want you to order anything. Okay, maybe they want you to use your free gym membership. But it's pretty clear that their coverage rules, their high deductibles and co-pays are telling you that they want to keep you from getting any kind of high-cost care. One similarity between the commercial health plans and the restaurants. Commercial health insurance offers you a menu. It's just in a foreign language with unintelligible prices. You have virtually no idea which doctors you'll be able to use or what you'll pay if you need care. The cynic in me says that's to make sure you have no clue what you're buying. What happens when people in commercial health plans need complex and costly care? Too often we hear the horror stories. Which commercial health plans are A-rated? Are there any? How would we know? Here's what we know. If we all got together to offer the best commercial insurance available with a robust network, or no network, the best hospitals and doctors, we'd be out of business before we opened our doors. Everyone needing costly care would sign up. We couldn't spread costs across healthy and sick. We couldn't afford to deliver needed care. That's the problem with commercial insurance. It's why incremental approaches to health reform that keep commercial insurers in the mix are problematic. They put people with costly needs at risk. And what's worse, they threaten traditional Medicare. Let me explain. Medicare Advantage plans, as an alternative to traditional Medicare, are a perfect example of the dangers of commercial insurance. Their rationale was that they would drive competition, bring down Medicare costs, and give people a choice of health plans. In fact, they drive up Medicare costs, and they take away people's most important choice, seeing the doctors and hospitals they want and need anywhere in the country. Worse still, because they keep out-of-pocket costs low for people who are healthy and shift costs to people who are in poor health, they attract healthier people and leave traditional Medicare with sicker enrollees. We might think of them as corporate take-advantage plans that take advantage of taxpayer dollars and undermine traditional Medicare, or fake advantage plans that disadvantage the Medicare program. Medicare Part D prescription drug coverage is another example of the dangers of relying on commercial health insurance. People get drug coverage, which is great, but through commercial insurance plans that can't rein in costs. They drive up costs, and that's keeping people from getting needed medications, as well as costing taxpayers a bundle. So, what have we learned from the Affordable Care Act in history? Was the ACA progress? Yes, if the measure is the number of people insured and the elimination of pre-existing condition exclusions. But the ACA also took us many steps back. It gave commercial insurers more business, more power. As a result, healthcare costs are even more unaffordable for many. Underinsurance is still keeping people from getting care. What did we learn? We learned that a federal law that subsidizes commercial health insurance costs only grows corporate power. And when it relies on states to implement the law, it leaves commercial health insurers largely free to operate unchecked. Most states, truly all but a handful, if that, don't have the will or the power to protect against commercial insurers. We need a federally administered healthcare system. Okay, why not Medicare Advantage for all? I'm hearing lots of people proposing it quietly now, and I think there's going to be a big push for it. I think that is absolutely the worst proposal out there by far. It scares the hell out of me. Without traditional Medicare, Medicare Advantage plans would no longer be able to piggyback off traditional Medicare rates. Medicare Advantage for all would drive up Medicare spending, since commercial plans can't control costs. Or more likely, to control healthcare spending, government would cut payments to those plans, which in turn would shift costs even more onto the people who most need care. And without traditional Medicare in the mix, as I know you know, Medicare Advantage plans would have even less reason to offer good networks because they would not be competing with traditional Medicare for enrollees. Without traditional Medicare, people with costly and complex conditions would be at greater risk of not getting the care they need in their Medicare Advantage plans. Now, at least they can switch to traditional Medicare when they need costly care, as they often do. So what about the 1 in 3 people with Medicare and a Medicare Advantage plan today? Do they really like it? It's hard to believe they choose their Medicare Advantage plan because of its restricted networks or high deductibles. More likely, they have no real choice. Some employers force retirees to sign up with a Medicare Advantage plan if they want retiree health benefits. Some states force people with Medicaid and Medicare to use only a Medicare Advantage plan. And some people, many people, can't afford the costs in traditional Medicare. The upfront costs in traditional Medicare are about $3,000 more than in a Medicare Advantage plan because you need supplemental coverage. So they can save $250 a month on supplemental coverage if they join an MA plan. My bet is that few people would choose a Medicare Advantage plan if traditional Medicare were improved and expanded and did not require you to pay all that money to fill the gaps in coverage. Why not traditional Medicare for all? Well, certainly it would be a huge improvement, but its design undermines access to care still. I mean, the good news, it treats everyone equally, it guarantees coverage and choice of doctors anywhere in the country, but it's broken out into multiple parts. There's no catastrophic coverage cap. You need the supplemental coverage. And then, of course, there's no long-term care supports and services covered. There's no vision, hearing, or dental. So we need to improve on traditional Medicare. And that brings us to Medicare for all. That speaks to our values. Healthcare as a right or basic need, not a commodity. Freedom to choose our doctors, the security of cradle-to-grave coverage, affordability, bringing us all together, the efficiencies of one system, the ability to innovate, to have transparency, to see what's working and not working in our healthcare system, and equitable progressive financing. There's only one road to Medicare for all, and there are a bunch of national proposals that are, as you know, taking us off-road. The state work has been amazing. I mentioned here California, Vermont, New York, and they are great stepping stones. They're important efforts, as you all know, to educate and galvanize the public. It would be wonderful to have any state with a single-payer legislation. But what about Mississippi and Louisiana and Arkansas? We saw what happened when we gave states the right to expand Medicaid through the ACA. To protect everyone, we need one program for everyone, and federal law is key. Okay. So what's out there now? We have Senators Merkley and Murphy offering us up the Choose Medicare Act. Okay, the good news, Democrats want another health care debate, yay. They see the problems with relying on commercial insurance, and they see Medicare as a piece of the solution. But bad news. Choose Medicare Act builds on our broken state-based commercial health insurance system. What does it do? It gives people, individuals, and businesses the choice to buy into Medicare if they can afford it and they want to pay for it. And it might sound like a good choice, but no. It splits the baby. It keeps commercial insurance in the mix. It does nothing to rein in costs. It drives up costs in traditional Medicare because people who are less healthy join. It assumes that individuals and companies would benefit from the public Medicare program's strong bargaining power. But it's just as likely that it would weaken Medicare. It would gain a larger pool of people needing costly care, driving up Medicare premiums. Commercial insurers know how to cater to the healthy and steer the less healthy people to Medicare. And it's fair to assume that's exactly what they would do to compete. Senator Murphy argues that their bill is the best path forward because it allows a way to, quote, test the idea that Americans will want a Medicare product. We already know they do. And then we have the Center for American Progress proposal, which is a new enhanced version of Medicare and Medicare Advantage. And it has many limitations, and I'm going to go into them. It is a step up, though, from Merkley. It has some good fixes, beginning with an improved and expanded Medicare program. The CAP plan does guarantee cradle-to-grave coverage for all, and it doesn't rely on states to oversee the system. But even as it creates this stronger Medicare plan, which they call Medicare Extra, it threatens Medicare. It creates a stronger Medicare Advantage option with all its issues and lets people keep the commercial coverage they have if they like it. CAP attempts to level the playing field. They do understand that the commercial insurers are gaming the system every which way they can, and that's a noble effort. But as I think we all know, it's a Sisyphusian task, and likely the plan's Achilles heel. Commercial health insurers have always been able to outmaneuver the federal government, and let's not negotiate against ourselves. So that gets us to Medicare for all. Yay! All right. And we have the Sanders Medicare for All Act and H.R. 676, bold visions. They end commercial insurance. They're efficient, effective. You know it all. Doctors and hospitals competing for patients in a free market with less waste and bureaucracy. Lots of great stuff. Obviously, the Sanders plan is still missing long-term care supports and services. We need that. We have that in H.R. 676. But they're strong, and they speak to our values: freedom, security, unity, efficiency, equity. As it turns out, the original GOP arguments against government-sponsored health care have proven to be the strongest arguments against commercial health insurance. What they said when there was talk about expanding Medicare back when is, quote, "It's crushing cost, wasteful inefficiency, bureaucratic deadweight, and debased standards of medical care." And that is what's wrong with commercial insurance, and that's why we need Medicare for all. We've been working hard, and we've made some great progress. The organizing is working. The stage is set. Medicare for all is in the air. Onward!
Thank you so much, Diane. That was really a comprehensive presentation. And I have to say, thanks to everybody's discipline, including all of you, we are almost, not quite, but almost on time, and we have a few minutes here to take some questions. So raise your hands, and we'll try to move through the crowd. I'm going to start. Whoever gets to the person first. Ben, why don't you go?
My name's Pam Gronemeyer, and I'm a physician from the Metro East of St. Louis, and I turned 65 in January. And I will tell you, I mean, they're saying now baby boomers are going towards Medicare Advantage because they're used to, they like what, they see those plans sort of like what their employers see. But the problem is they hound you, and they lie to you. I mean, I signed up for conventional Medicare, and I signed up for a supplemental all before January 1st. But they're still calling me. And when you ask who's calling you, you'll say, "Are you the government?" "Oh, no, we're not the government." But most people don't know how to ask or what to ask for. I'm a doctor, and I mean, they're hounding me now. So what happens is they do unfair marketing in addition to, I mean, and with giving you the perks, but they just lie to people on the phone. And
they get away with it.
And they get away, yeah, I mean, unless you say no. Medicare called me. When I called up and said I want to sign up for conventional Medicare, they gave me a time, a date, and they called me that time and that date, and everything was done. So, I mean, I just think we need to call them out as the liars they are.
We do.
Okay.
Diane?
Yes.
Hi. Rachel DeGolia from UCAN, Universal Healthcare Action Network. So while this campaign is gathering momentum and steam and moving forward, there are also a lot of really important efforts to expand access to healthcare for people, particularly at the state level. I wonder what you think about efforts like in New Mexico for Medicaid buy-in Do you know much about it?
I know nothing about it.
Okay.
Hi. So I'm Noah. I'm from Pennsylvania. I'm a strategist from Pennsylvania. Thanks for your remarks. Thanks for the comprehensive overview. We have mass support for Medicare for All, but we really haven't started the fight yet with the mass opposition. There's a lot of players in the opposition. You mentioned the GOP. There's commercial insurers. There are consolidated medical groups. In Pennsylvania, we have Gagne and UPMC, who are both offering medical services and insurance, HMO plans. There are also new players of the space, CVS acquiring Aetna, and then even things like the Bezos, Buffett, JP Morgan venture. So there's a lot of opposition, and I'm curious, which do you think are the ones to be most threatened of? And what direction will they go? What compromise will they make when the majority of American people are looking for a solution?
I think we have to be worried about all of them, and I don't think they're going to be ready to make any compromises anytime soon, right? We're going to have to push super hard for what makes sense and what's fair and what we know the majority of Americans believe. There's no way the medical industrial complex is going to back down quickly or even over time. They're going to the last minute, they're going to be fighting and giving tons of money to members of Congress to support their causes. I mean, we saw what happened with President Obama and prescription drugs. They're not backing down.
Ken?
Well, I just want to tell you a little story about Medicare disadvantage. You know, these are all the good reasons that it's bad, okay? But I want to tell you the moral reason. The Medicare Advantage plans actively seek people to die, okay? My father was in a traumatic accident, fractured pelvis, internal injuries, had a Medicare Advantage plan, had to be sent to the tertiary care center to Loma Linda in Southern California, great hospital, saved his life. After 2 weeks in the ICU, when the doctor said it was time for him to leave the ICU, the Medicare Advantage plan said, oh, we're going to transfer him to our rehab facility, which was a horrible nursing home. Fortunately, we had myself an RN, my brother an RN, my sister-in-law an RN, and we knew that they weren't going to do that. And we fought them and we beat them. But most people would have just gone, and he would have died there because he was too old. You know, talk about death panels, they got him.
So I've been coming to these conferences off and on since, I forget if it's 2010 or 2011 in Philadelphia. And back then and today, I'm still hearing a same tension about whether the state level approach is in effect an incremental step. And, you know, I understand the issues about the unity, but at the same time, Healthcare for All Oregon kind of swerved too much the other way, perhaps, where we just felt like the federal level, you know, wasn't going to be possible for a long, long time, and that states moving could shake that up. And, you know, turns out Bernie Sanders and Donald Trump in combination could shake it up too. But I do want to say that I feel like we need to grapple with this, because, you know, the fellow from DSA, which I belong to, was, one of those 5 criteria was single national unified system. And yet, I know that the DSA chapters in California are behind 562. The Cal Nurses, National Nurses United, have always been for national Medicare, and yet they are also for the state bill. So how do we square the circle about this? How do we,
I think it's a great question. I think it's actually easy. I think everything you're doing at the state level is really important because it's educating people, it's galvanizing people, it's helping people at the local level understand the value of single payer. And that's critically important both at the state level and for the federal ultimate victory. So I think it's really great, and you should keep doing it, and we should keep fighting at the federal level as well. But as you say, right now, the federal work is harder because of the challenges of Congress and our president.
Hi, Martha Livingston from PNHP New York Metro and the Labor Campaign for Single Payer. I've been working on this forever, and I want to make a point tying what Diane's presentation has done and what Michael Leidy's presentation did. Michael made the extraordinarily important point that we're for health care for all. That's a great thing. But we're also for health for all. We are also for housing for all. We are also for getting rid of health disparities for all, doing everything we have to do to make this country and this world a safe and peaceful place for people to live. Why am I mentioning all this right now? Because I want to remind people that what we keep hearing is, oh, this is the ultimate goal, but we have to take steps along the way. No, it isn't. This is an incremental step forward on the path to health justice and a just world. Nothing more. And the only reason we don't have it is that it will take down 1/6 of the economy, and they are not going to let us get that without a real fight. So just keep our eyes on the prize, folks. This is not some pie-in-the-sky radical idea. Let's join the 20th century and get health care for all.
Two more.
Two short statements. We need to educate people, and the two short statements that I use is I explain to people what medical loss ratio means. Our care is a loss to the insurance companies, and that infuriates people when they realize that. The second statement is that it's okay, it's a good thing to earn a living working with sick and disabled people. It's not okay to make a profit from their suffering, and that's what the private insurance companies do.
Just a comment and a question. Did you get a chance to mention co-insurance? Because that's the other sneak preview for Medicare Advantage plans. You enter those plans, and then in the small print somewhere, they're saying co-insurance, and you think, oh, I've got another insurance plan somewhere. And it turns out that those add up to about 20% of certain costs that you may incur. And if you're going through something like chemotherapy, or you have to have repeat MRIs or anything like that, it will bankrupt you because you have to pay 20% of whatever that facility is charging. So that was one thing. And the second thing is, very briefly, this question of choice. In certain areas, certainly where I am in Metro Atlanta, Georgia, there's the delivery system is very monopolized, right? So you don't really have that much choice anymore, even in terms of a traditional Medicare system. And the last thing is, if you go with an Advantage plan, you're going into a private system. Where is the accountability? And that's what's so critical about our relationship with the government and Medicare.
Excellent points. On the Medicare Advantage point, you should know anybody who gets really sick in a Medicare Advantage plan can have to pay in-network $6,700 each calendar year out of pocket, which means if you get sick in December, you could be paying out of pocket close to $14,000 between December and January, which is ridiculous. And that's what keeps people from getting care. In terms of accountability, I do want to share one of my favorite stories of the last couple of months. I was at a meeting where George Halverson was speaking, and he was talking about the benefits of Medicare Advantage for all. And I pulled him aside at the end and I said, my understanding is that at Kaiser, you're learning all kinds of important things about medical devices that work and ones that kill people, and about medical protocols that work and ones that kill people. And you don't share any of that. And a good public health system, we learn from what's broken and we help make sure that other people aren't harmed from it. And he said, I agree, that's a problem. So that's the accountability we have from the commercial health insurance system. It's absolutely unacceptable.
Please thank Diane Archer for her wonderful presentation.
All right, folks, we're wrapping up for today, but there's a couple of interesting events happening after we close the formal agenda here. DSA is having a breakout on socialism and single payer from 5:30 p.m. to 6:30 p.m. That's going to be in the Norway 2 room across the hallway. Then a little bit later.